If you allow me, I would like to briefly summarize the topic because so that we can easily keep it in our mind if we repeat. When we say ADHD, it is seen by 56%, but if we check the symptoms, it affects the patient by 20%. Sometimes we consider about overdiagnosing, but no. On the contrary, we are anxious that sometimes we cannot diagnose the patient. And then it will lead problems. It will lead to problems for the patient, both academically and in the social life. So the most efficient treatment is needed, and it should be done in the long run, unfortunately. But so in terms of side effect, it is disadvantage. And also, can the drugs treat ADHD permanently? That's another question. Because in studies, after 2 years, we couldn't do any positive effects in the light of meta-analysis in drug treatment. What is the other problem? We talked about side effects. And now, during drug use, there might be side effects that have a negative effect on growth. Let's repeat, another concern is to use those drugs. So in the long run, there are problems, both in the growth and also some symptoms like sleep disorder, etc. So we are quite concerned about the side effects of the drugs. So by 65% that we have a group that doesn't benefit from drug treatment. As I said, while using those drugs, we are quite concerned about the side effects. So what can we do about this? Firstly, we can go for neurofeedback as a part of behavioral treatment. It started in the 70s. And starting from 90s, it was named as neurofeedback. It seems rather new, but actually it traces back the old times. What are the factors? In brain, we have alpha, theta, beta, and delta waves. Those 4 waves in the studies, some differences were detected, or in terms of amplitude and the severity. If we correct those differences, can we treat the patient effectively? That is the question. How can we do that? Those waves, what are those waves and how can we calculate them? We have hertz, like 4-5 hertz, 15 to 20 hertz. To simplify, we have radio frequency. So in the frequency you switch between radios because of the difference in hertz. Alpha, beta, delta have similar hertz, so they get along well. So we need similar frequencies. And sometimes you meet someone, but you don't have any sparks from that person. It's like that. We have another critical study. In the studies conducted, people the more people spend time together, the more their waves, their frequencies get closer. So how can we change those waves? Simulation games were designed for that. I mean, let's say there is a car and you want to increase the alpha wave in the patient. Think it as a car game. I mean, the car is susceptible to alpha wave, and if you want to increase it and if you target at it in the training programs, you can give neurofeedback to the patient. And in the studies, it's quite controversial, because when the patient moves the car, then there are some effects on the reward mechanism. So it is quite hard to put our finger on neurobiofeedback. So is neurofeedback complementary or alternative treatment? That's the question. We need independent studies about it. On one hand, we should have drugs. On the other hand, neurobiofeedback, and also maybe we can compare them to combined therapy. Those studies were conducted, but there were lots of handicaps in those studies. APA. In APA's guideline, we have neurobiofeedback. APA double-blind studies are not needed for APA to put the study into guidelines, so it is a little bit deceiving. On the other hand, it is quite controversial that should we go for a double-blind study or drug study? We know that the patient takes the drug, but how can we evaluate the motivation of the patient or the learning capacity of the patient and the improvement? Also, the wave in the mind of the patient. I mean, which one? We have 3 types of neurobiofeedback, and which type is suitable for the patient? Considering all the factors, double-blind seems a little bit challenging. Another thing is, the problematic part in the studies is families want neurobiofeedback. I mean, it can be deceptive. So we have lots of handicaps in those kind of studies. Also, in assessment and feedbacks were only taken from mothers. So it weakens the effect of double-blind studies. Feedbacks from teachers are more suitable to double-blind studies. So all of those factors create a bias. An alternative treatment. In the studies, especially in ADHD, we have a similar effect to methylphenolate. But we have a low activity, and we have lots of factors and lots of adverse effects. What are the findings for combination treatment? That's our concern now. It is early to call it alternative treatment. in combination treatment that we call complementary, methylphenylation is decreased. It is good in terms of decreasing side effects. And also the beneficial part is increased. Also neurocognitive tests are used. And the changes were observed with 2 years of intervals, and positive improvements were detected. Therefore, we have an increasing benefit. As a result, there is also a financial aspect regarding firms, and we have also concerns about it. But as scientists, we need to contribute in the field. Starting from 70s, we have 50 years of past, but you say the point we reached is not that much desirable. Including APA, we have a support mechanism. Sometimes we need to take a firm stance against the drugs. We shouldn't be that much concerned of the firms. So we need to be aware of the long-term results, because we take the neurofeedbacks, but we are not that much certain of the side effects in the long run. So we need to be careful about selecting the drugs. Another target should be that we need to specify the groups for neurobiofeedback. Because if we can specify them, we can select the correct group and patients. Alpha wave increases during sleep, and in those kind of patients, methylphenylate had better effects. So we need a differential mechanism in terms of treatments. Maybe we can go for individualized neurobiofeedback. In Cuba, EEGs of the patients are recorded to get a standardized data. Because if you standardize it, no matter how we compare the groups with healthy groups, we have lots of comorbidities. So when you separate the comorbidity, neurofeedback will have a better effect. So if we have a question that what is ADHD? Also, what are the fortes and disadvantages of the treatments? And what are the effects of neurofeedbacks? And why is neurofeedback not included in the guides of ADHD? I talked about ADHD already. You see the symptom rate is 20%. We have complaints coming from parents and teachers. However, because of overdiagnostic concerns and side effects, we don't know their side effects in the long run, and also psychostimulants are another concern. So what are the disadvantages? We have 0.15 percent of the group that don't respond to the treatment. Also, in a study by Barkley, you see 35 to 45% of the patients diagnosed with an intensive type, and 10 to 13% was called as combined. And in terms of behavioral therapy, we see neurofeedback. So what are the underlying effects? Electrophysiological abnormalities can be counted. We need to correct those electrophysiological differences. I mean, deviated waves should be changed. By 65% of accuracy, we call excessive beta ratio. We have different neurofeedback types: beta, theta type, sensory, slow cognitive type. As for biofeedback, it is called. And we have conditioning procedure to correct the waves. It was firstly used in epilepsy and in sleep disorder, insomnia, depression, head injury, in lots of psychiatric disorder. NF has lots of research. It also includes drug abuse. And by 20% of complaints that we have, and if you make the patient recover from sleep disorder, neurofeedback is a nice tool. You see alpha, theta, beta waves, and you see where the waves coming from. From basal ganglia, it comes to the surface. 6 millimeter of you see 6 millimeter that measures the waves. You see theta wave, and in the simulation on the game you see frequency is received, and then you can make a bird fly or you can drive a car from that game with the waves. Double-blind studies are not sufficient. Also, about alternative treatment, there are lots of bias. We have lots of factors. ADHD and impulsivity, in treating them, it's quite effective. 0.4, you see the and between when comparing NF and metaphenolate, you see the difference. ERP, you can go for visual or auditory stimulation. First, the patient sees it, and then we have P100 waves. And then the decision-making process starts. So in this eyes open condition, we have also active task condition. But when compared to drug group, neurofeedback stayed a bit weak. It has positive effects, but when you give stimulants in daily life, we expect positive effects, so neurofeedback still lacks.
Dediğimiz gibi genelde ailelerin seçmesi.
Also, selecting families are another issue. We see that NF still has positive effects. Moving on. As you can see here, this is what can resolve the problems in the treatment of neurofeedback. So we can go for NF plus medication, NF plus placebo. This study can resolve this issue. In terms of the long run, you need to spend time with the study in order to get close and understand the effects in the long term. If the treatment is effective in the long run, follow-up studies are recommended. So that you can exclude the negative effects. But there is a warning. We still don't know cellular effects of the increasing waves in NF. Thank you so much for your attention.